So, good afternoon, everyone. My name is Misha Allen. I am a proud board member of the Cancer Survivors Park Alliance. And thank you for joining us for tonight's Prevention and Wellness series. Tonight, we're going to be talking about financial navigation as well as removing financial barriers in oncology care. I am so delighted to have Karen Hausner, who I've had the privilege of working with her alongside mutual patients. She's a wealth of knowledge. And I think tonight's topic is not only going to be fruitful if you're a direct patient, a loved one of a cancer survivor, an advocate, in any walk of life as it pertains to oncology. I think it's so important for us to not only be informed of what resources are available to help patients who are navigating different financial barriers along their journey of cancer, but most importantly, to be encouraged and to know that you can be an advocate for yourself if you have the proper and right information to know what may be available to you. And so, before we should dive in, Karen has put together a lovely presentation that will consist of some case studies, as well as some resources, and simply just some statistics just to show how prevalent this conversation is to our patients, as well as for you to know what she does on an everyday basis and how important it is to have a financial navigator. So I'm going to pass it over to you, Karen, and I look forward to having this discussion.
Great. Thanks. I'm happy to be here. I am a financial navigator at Bon Secours Mercy Health at St. Francis Cancer Center. And so I thought I would take you through what we do, how we do it, and then have some conversation around, different resources that might be available. So our program is designed to lessen the financial barriers while advocating for patients and allowing them to focus on their journey of healing. That's the biggest thing. I have been working with patients, not just in oncology, for the last 15 years or so, and we have just found anything that we can do to reduce an out-of-pocket expense increases people's ability to be compliant and focus on what they need to do to care for themselves. And, there's a couple different areas, direct costs, of course, that's sort of an obvious one that people just get overwhelmed with. And then there's the indirect stuff, loss of a job, reduced work, things of that nature. But a really big one that I talk with patients about, more so because they bring it up to me, is, the psychological aspect. There's a term in the cancer world of financial toxicity. And it's just about stress and anxiety and worrying about things and how it affects their treatment and their, healing process.
Absolutely. And I couldn't agree with you more, even coming from a social worker standpoint. As you mentioned, a lot of patients, like you said, it's already challenging enough to process a diagnosis alone, and even the unknowing of what next steps look like. How am I going to pay for this? What does insurance cover? What does insurance doesn't cover? And so I think it's so important to not only address, the financial needs, but alone as to processing and knowing what your options are. And I think it's important too for patients to know whether you're insured or uninsured, there are options, there are resources available. And I think, again, with you stating, of course, a role as a financial navigator, and we talk about this often because every healthcare site might not always refer to that role as a financial navigator.
Correct.
And so, Karen, is there any other names or terms that you hear often for other healthcare sites that may refer to this role?
Yeah, absolutely. And there's financial counseling, which we also do some of that. We have financial counselors here, but they do something different.
Yes.
So we take more of a holistic approach to really look at everything right at the onset of treatment. So people know going in. Financial counseling, financial case manager, patient navigation, and even those terms they could be doing something just a little different.
Mm-hmm.
So I always tell people when you get in a hospital system, no matter what system it is, ask about what resources are available
Yes.
and, financial counseling. Okay, what do they do? Do you have somebody who does something else
Mm-hmm.
that helps? Because sometimes hospitals themselves aren't very good at always articulating
Mm-hmm.
who does what,
Mm-hmm.
and it can get overwhelming because now you've got a financial navigator and you've got a financial counselor that you talk to, and then you have your social worker that you talk
Mm-hmm.
to who is also talking to financial navigation and financial
Yes,
counseling, and
I agree.
you know we collaborate here, I think, pretty well
Mm-hmm.
with that. Not all hospital systems do.
Yes.
I've worked at other ones that did better than others.
Yeah.
So, those are some titles per se
Mm-hmm.
of people that could potentially help you in your whatever system you're working in.
Now, if you can give us an example for a patient who's newly diagnosed, been informed that they're going to have some form of treatment, whether that be radiation or whether that be chemotherapy or even just some form of an infusion as far as immunotherapy, what would you advise or what steps typically are set out for a patient who's walking through the cancer center? How does that look and how are they connected initially to you?
Initially, here in our hospital systems, we connect right after diagnosis.
Okay.
So when someone knows they're going and the treatment plan is in place, we do financial counseling and address those things.
Okay.
So that when you come in, what your insurance is going to cover for your infusion. If we need to get assistance through a manufacturer program for that. Myself personally, I do the oral medications. And so I am engaged very quickly as well, especially if it's, dual treatments going on,
Mm-hmm.
and whatnot. So I collaborate with my coworkers that do infusions. And then we look also even at a bigger picture in the sense that, are you a Medicare recipient? Are there other benefits that you might be entitled to
Mm-hmm.
when it comes to Medicare that you're not automatically enrolled in it, even
Mm-hmm.
though you might be eligible,
Yes.
right? So you could have a lower income, let's say, and maybe you would be eligible for assistance with medication for your Part D, but they don't automatically enroll you. So unless we have that conversation, or
The lights gone out. Give me 1 second.
there we go, something happened. Let there be light.
Let there be
Here we
light.
go. How about that?
Okay, but Karen, what were you stating?
So there are benefits available to people that maybe that you got something in the mail when you apply for Social Security, disability, or retirement, but you get so much stuff that, we try to help weed through that because I know what the qualifications are. So I might ask some questions and get into that piece of it. And if someone does qualify, it reduces a drug that could have a $2,000 copay to $12.
Wow.
And it reduces the deductible that you have to pay to meet
Mm-hmm.
goes away. So there's other financial benefits to it
Mm-hmm.
if somebody qualifies for that.
And you can imagine, even as a patient, of course, the wealth of knowledge from someone who knows nothing about insurance, as well as what makes a person eligible for Medicare, what makes a person eligible for Medicaid, and then as well as people who are highly educated and trained in this profession that you currently work in to know what things may be available to them. And so I'm glad that you were able to give us an idea of not only what does financial counseling look like to you, but also what things should a patient who's coming into a new walk of life, not knowing what to expect, what things should be at the front of their mind. And as you can imagine, it's already a lot to take in as far as what to expect from a treatment standpoint, what's going to happen far as for the patients who are working and insured through their
Yep.
employer. What does that look like? If, their benefits should change based on their work status. And so I think it's extremely important. As you mentioned earlier, what you don't know, you can't ask about, and you don't know, what things may be available. And so, Karen, can you dive in a little bit too for the patients who may feel discouraged because they have no insurance? What does that look like? Do you feel like that's to a disadvantage or not
Well,
necessarily?
Honestly, it's easier to get people assistance through the manufacturer programs when they're uninsured.
Oh, wow.
Because when somebody has an insurance, then there's criteria, right? So like if you have a plan through your employer, let's say, and you're prescribed an oral chemo drug and it's very expensive. Well, we will assist with getting a copay card. But let's say then all of a sudden that drug goes generic, right? So now your insurance company says, oh, we're not going to pay for that other drug now. There's a generic drug, right? And everyone thinks generic, this is great because in non-specialty drugs, it usually means it's cheaper, right? In the cancer world, it does not, right? So now we have to apply for the generic drug, which is also expensive, which also has a copay card that's not as good as the other one, right?
Yeah.
You see where I'm going? So like, to help people navigate this. So then what do we do? Right. And I have an example later. I'm kind of getting ahead of it, but it's just hard not to.
No,
when
absolutely.
So then I work with the providers and I say, hey, listen, this is what we're up against. And I work with pharmacy and I say, can we go back to the original drug, which is the name brand? I'll get the denials from your insurance. And then I will go to the manufacturer and say, the provider wants this drug, the name brand. Here are the denials from insurance. Please help us with a free drug program. And then we get the drug for free.
Wow.
Now, to navigate that on your own, people would never know,
right.
And that's why we do what we do. And the landscape in pharmaceutical is ever changing, right? And I have difficulty keeping up, right?
It's so innovative and new things come about all
day. New things coming out, new drugs coming out, laws changing. When that changes, when Medicare changes their rules, the manufacturers respond accordingly, which means, oh, Medicare is going to cover this. We're going to change our program, right?
Right.
So, that's some of the value too, I think that navigation brings to people is our ability to know what's going on. We're not just filling out an application and submitting it and saying you're applied and you're approved. We have to advocate. We have to make sure we've got everything. I know letters that we write, just, different things that we have learned along the way that help. And I have situations where people apply on their own and then they get to me and they say, oh no, I already tried to get that. I can't get that. And then we get it approved. And it's just because we've learned, the system,
the expertise that you have through experience. Absolutely.
Relationships with field reps say, hey, listen, this is what we're up against. Is there something I can do differently to get it through your program?
Absolutely.
And you know what? There are a lot of the drug manufacturer, the reps in the field that aren't the salespeople. They're resources for people like us. So they're advocating as well. Yes. Right? So having those relationships, I have learned over the years and it have been very helpful.
Absolutely. And you brought a good point far as like again advocating. And when you think about the patients who may not be in sound mind or have the insight to even pose what questions to ask or even to know what things have been exhausted or to even keep track of that. I mean, alone just knowing when your appointment is and when you're supposed to follow up just is organization itself. And so with you even alluding to who to speak to, when to challenge something in the most professional way, but knowing what things still could be to your advantage if you receive a denial and what other things could still be, an option. Of course, your first instinct would be to be discouraged, if you're not aware of these things and to see a denial and then have, like you said, the psychological impact of just the worrisome of not even getting what you need.
There, I have patients call me and they're excited because they got an approval from their insurance company. And I often say, I am glad it got approved. However, approval doesn't always mean affordable, right? So your insurance might approve the drug and tell you that the copayment is $2,000. Then what? That's where, I have had people say, oh, I'm not going to be able to get that drug.
And what organizations you were talking about, like manufacturing companies, copay assistance programs, what things can you, far as give us example, or what are some of these organizations or companies that you're working with to help address these needs?
We like to look at foundations initially for a couple of different reasons. One very important one is that, and I'll use a Medicare example again, but it also does work with like your employer insurance. When I get a foundation, so there's Health Well Foundation, Cancer Care, Patient Advocate Foundation. There's a number of them that we look at, and they are typically disease specific diagnosis. And then we go in and then we get assistance for the cost of the medicine. Also, some of the manufacturers, some of these foundations will also reimburse other things.
Oh, wow.
Okay. So, premium assistance. So you're a Medicare recipient and I get you a patient advocate foundation grant. They will pay the copay for the drug, which when it goes through the system, the claim goes through, it pays it as if you paid it as the patient. And what that does for you is it helps you meet your out-of-pocket expense without you paying it. So I like foundations for that reason, because with Medicare, as soon as you meet that maximum out-of-pocket, all your meds are free. It's all covered under Medicare, okay? And then two, premium assistance, Medicare Part B is $200 a month for some people.
Wow.
They can get that reimbursed. If you don't have a supplemental plan and you go and Medicare has an 80-20, they cover 80, you pay 20. You can submit that bill. So I personally find foundations add a lot more value financially to people. But they're not always open. They open and close. They're sort of unpredictable, but we look at those first. And then we go to who is the drug manufacturer of this drug and do they have a program?
Now, for your patients who may feel comfortable and knowledgeable to do some of these applications on their own, are they necessarily able to do these things, or is it typically done by a healthcare professional?
There is, I do have sometimes people went and applied on their own.
Okay.
And then it, comes back to us. But there is always a page that the provider has to fill out.
Okay.
So it usually makes its way back to us.
Right.
Because otherwise they can't get the drug. It has to be signed off on by a provider, but they're not horribly difficult, the applications. They're really not. But, with so many changes in with everything with Medicare, especially it has become a little more challenging, the outcomes. And like I said, we kind of know certain things, as an example, if somebody doesn't have a Medicare program, but sometimes I can write a letter of hardship and it lets them in the program, so
Yes.
there are things that we have learned to do to help,
Mm-hmm.
but people do go out and do things on their own too.
That's good. That's good, Karen. And even just for me as a social worker, of course, I don't always know all of the resources. And that's where our working relationship comes in because, as you've known, for me to say, hey, Karen, I don't know what we can do about this situation, but is there anything that you feel like this patient may be eligible for? And I think it's good to know that you work alongside other professionals that have expertise in different areas and still come to a meeting point to help a patient work through these
Right.
barriers.
And it's hard. I mean, I'm fortunate. I've worked in other hospital systems and I didn't always just do medication. So it's provided me the knowledge to share with people
Mm-hmm.
that even if I'm on the phone with someone about a particular drug, even sometimes it happened today actually. Someone said, "Well, I just applied for Social Security disability and I'm waiting for a determination." And so my bell, she goes, "I'm applying for SSI." So then I'm thinking, okay, so she's going to get Medicaid with that. And then I look at her diagnosis and I say, "Did you do this on your own or is someone helping you?" And the reason I ask that question is there are certain cancers that are on Social Security disabilities adult listings they call compassionate allowances, right? And a compassionate allowance is they expedite that process. So Social Security disability can take a really long time.
Absolutely.
But if somebody has certain cancers, they expedite, or heart transplants, or there's a whole big list. So I went down that conversation with her because it's been a while, and in my mind I'm thinking, why is this not approved yet? Right. So I gave her some ideas. I gave her the word compassionate allowance. That's what you need to use when you're calling Social Security and say, this is on the compassionate allowance list. Why is this not being expedited? Right.
Wow.
So just trying to help people in other areas. And
Mm-hmm.
again, I'm fortunate I have that experience. And so I try to share that with them and help people because here she is, no income, no insurance. She needs costly medication and all these things are out there and she's waiting. Right?
Yeah. Yeah.
So, just those are just some other examples of some things that I personally try to do and share. Um, and I don't know all of the community resources here, so that's
Yeah,
what
it's
that's
a
what
it's a it's
that's
a
what
here back and forth effect, of course, and that's where I think is I tell you all she's a wealth of knowledge, and I mean it. But no, it's exactly what you said. Using not only different hats and connections, even when you mentioned, far as like working with certain people within these manufacturer companies outside of their drug reps and such, because even you mentioning a letter, a hardship letter, how far that can take a patient. And even those things that we might look as a small thing make a world of a
yeah,
difference, especially when you're in a trying time of, like you said, just trying to navigate things as they come up, but just truly feeling like I have someone who I can rely and depend on to make sure I get the proper medications or the proper coverage that I'm eligible for. And I have no even awareness of,
right,
that being
right,
available. So
right.
I think that's awesome with the work that you do.
Yeah, I had
Yes.
someone today actually say to me, well, we're overwhelmed with all this and it's very confusing and we've never been in this situation. And so my response is, of course you haven't,
Yeah.
right? So that's why, we work together, and I really go through, today I had a person who had a long list of medicines, and typically we focus on oncology. But when I see a person who has a long list of medication, even if it's $5 here, $3 there, it adds up.
Absolutely.
And, every little bit, especially in our economy, on top of, just having to spend so much in healthcare costs, anything, I just feel like anything we can do to reduce goes back to reducing the stress. They can focus on their healing journey, and um, it just helps them with that process.
I-
It just does. Um, Now here, I wanted to really talk about prior authorizations and medical bills, because these are two things that come up very often. Now, when it comes to prior authorizations, we typically do that. We have people that do that. We look, we go out, we get the prior authorization. If your insurance denies, we have people that will automatically appeal that denial.
Wow.
Okay, so we do that for people. If we need to do a peer-to-peer review and get the doctors to write letters, all those things, we will go through that process. If you are in a system that nobody's helping you with that, this is what I tell people all the time. Anytime you get a denial for anything, always appeal it. Michelle's doing her magic. Oh, there it is. There it is.
Such good information. We will not be defeated.
So we should always appeal, whether it's your medication, whether it's a prior authorization for any kind of a service, whether you got sick and went into a nursing home and something happened, you always appeal everything, always. That's a given for me. I always tell people, because unfortunately, I think we are in a state in our healthcare system that insurance companies will deny and overturn. So I know it's easy to panic and say, oh no, what am I going to do? I need this. It's going to cost whatever that dollar amount is, which is always way more than anybody can afford. Appeal, appeal, appeal.
And when you say appeal, because of course, a lot of these matters can be time sensitive, especially, if a doctor is advising you to start this form of treatment, whether that be an outpatient service or whether that be just a medication or even an inpatient service. What is typically the timeline, or what does that look like? Is there an expedited appeal? Yeah. And I know you mentioned far as peer to peer, but for others who may not even know what that means,
Yeah.
can you tell us kind of what that looks like?
Well, the first thing I'll say is, if you aren't sure if your doctor can help or not, you should talk to the office.
Okay.
Okay, so that's the first thing. And then, it depends on the insurance company. Some of them will turn an appeal around in a few days, and some of them, depending on if it's a medication, it could take longer. So it can be stressful for people. And that's why I say, really engage your provider, because somebody in the provider's office should be able to help, especially in a cancer setting. So whether they have a navigator or not, here at the cancer center, we also have nurses who do this, right? Nurse navigators and stuff. So, they can write letters. Medically necessary letters is a big thing that we use. And what I mean by peer-to-peer is insurance companies have providers and doctors on their staff, and we will have our doctor speak to their doctor to try to explain why this medicine is necessary. And, you know, there are different reasons medications get denied, right? Many different reasons, so many to go into. But, you know, sometimes that's all it takes is the peer-to-peer, the medically necessary information.
Mm-hmm.
But timing wise, it can be challenging because some of them happen quickly and some of them don't. You know, and I'm not talking months by any means, but 2 weeks is a long time
It
when you're
is.
waiting.
It
In my
is.
opinion,
Yes.
I know I am really impatient. I don't like 2 days, right? So when they tell me that it's going to be like 48 hours, I call in 24,
Yeah.
right?
Yeah.
So that's just me. And so that can be stressful.
And that speaks to your passion of wanting to get these things addressed within a timely
Well,
manner.
they have a big volume that they're working, and I know they have a process and whatnot, but you know, I'm gonna be that squeaky wheel, you know,
Yes.
you know,
Yes.
but if again, going back, if they don't have anybody, go to the provider, fill out as soon as you get it in the mail, I always say fill it out and send it back because it'll say right on the back, a prior auth or any kind of notification you got. If you want to appeal, this is what you need to do. And you have X amount of days to do it.
Or as a timeline.
Right? They put a deadline on us.
Yeah.
Right? But then they drag their feet.
Yeah.
But it is what it is, right? It is what it is. But yeah, I always say appeal, 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 appeal. And the same thing kind of goes with bills. If you get something in the mail and you're like, what is this? Why is this not covered?
Mm-hmm.
You know, there are steps to take for that as well. There's something called the No Surprise Act, and there's something called ABN for Medicare. So ABN, forgive me for the acronym, I can't even remember, but it's basically it's something that you sign that says if something isn't covered, I'm going to pay for it.
Oh, wow.
Okay. So, you know, sometimes you're signing it and
you don't
even really know. In the healthcare systems, they're saying, well, this is just in case it's not covered. But of course, you're standing there, you're going to sign it.
Mm-hmm.
Right.
But even just that piece of information alone, like you said, the fine print or the whole paragraph of,
but if you didn't sign it,
right,
you have a little bit more leg to stand on that you don't have to pay that bill. Right.
Now, what would you say? Give us some examples as to what would be a reasoning for denial outside of some of the obvious things, but what things would you foresee as to why a request, especially if insurance is being given this information for this diagnosis, for this treatment plan? With that alone, of course, some would assume, well, I'm giving you sufficient information as to why it's medically necessary.
I always say do two things. You should be getting an explanation of benefits from your insurance company, or you can call and request one. And then what I always recommend is asking the provider for a itemized breakdown of your bill, because you don't always get itemized breakdowns.
Wow.
Okay. And when you get the itemized breakdown, the billing codes are there. Right. And so, and I know it's a lot of work and patients should not have to go through this, but unfortunately, you know, it's happening.
Yes.
And so, you know, I've seen examples where a code was wrong.
Wow.
They coded it, you know, for, you know, a diagnosis treatment when it wasn't, that's not what it really was, or, you know, and the diagnosis and the explanation of benefits should equal. Right.
Mm-hmm.
So it is a little more work. It is a little confusing. If you're a little more computer savvy, I do this myself. because I don't know all the codes. I look them up, right? And you look it up and I say, oh, well, what is that? Like, because that code does not match what's on the explanation of benefits. So what did they bill for? Right?
Yeah.
So, so you request that itemized bill. If it is a denial, like I said, you can appeal and get medically necessary letters and whatnot, and escalate, get the provider involved if you need their assistance. But sometimes it's just a billing error,
Wow.
and you know the the other thing too is every hospital system has a patient assistance, financial assistance program.
Did you all hear that?
Did you all hear that? Every hospital I've ever worked at has a financial assistance program. So I always encourage, and they're all set up a little different.
Mm-hmm.
Some of them you have to have a bill before you can apply, right?
Okay.
And others you don't. You can just go and apply and then it's on file. And many of them go back 6 months or a year backwards and a year forward, or 6 months backwards and 6 months forward, right? So I always encourage people
To apply.
if it's a system that lets you apply, and then I always call it the waterfall effect, right? So they bill Medicare, and then you have a secondary insurance, and they bill that, and whatever's left over, it all rolls down to financial assistance, right? So,
And I think another myth, when you say financial assistance, some may assume, well, I have insurance, I may not be eligible. Would you still encourage, even if they had?
100%. Yep. I always
Wow.
encourage people to apply, because you don't know what, if something happens or falls outside, and like I said, every program is a little different
Mm-hmm.
with how they operate.
Different
Some of them,
situations.
if you're not
Yeah.
insured, they want to make sure you've applied for Medicaid or you don't qualify, or, or
Exhaustive
whatnot.
what resources?
You exhaust resources, but, they all have them. And the income thresholds, I think, and they vary, but they're higher than people think. I think sometimes when people think of financial assistance, they think of, a Medicaid, where, oh, I
Mhm.
have to be really poor in order,
Mhm.
and
Near the
you,
poverty
and you,
line
you
and
don't
such, right.
necessarily. And usually most programs um, are tiered, right? 20, 40, 60, 80%, 100%, I think ours here is 80 or 100. I think they have two tiers. I've worked in hospital systems that did have 20, 40, 60, 80, 100. So even if somebody is helping you 20%, I mean, it's
That's
better than
still
nothing,
right. Absolutely.
So, financial assistance, fill it out, send it in, send in the requirements. It's usually like a bank statement, people in your household, 1 month's income, pay stubs, something like that. And then it's usually good. Like I said, most go backwards and forward. It just depends on, you know,
And remember, she said, you all, if you receive a denial, appeal it.
appeal, 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 appeal.
Absolutely.
What else do we got here? So this, I put together a couple of case studies because I wanted to give some people ideas of different ways we help with navigation. So in this case, I think we're in the way here. So if I had a patient, they are concerned about affordability. If they can't get this medicine, they're a Medicare recipient, newly diagnosed for breast cancer. They have Medicare Part A, B, and D. D is the medication. We take it through and we look and we find out, okay, we got an authorization. It's going to cost $1,900. Okay, to fill Ibrance. Now, the maximum out of pocket is $2,100. So once somebody meets that, then it's covered in full.
Mm-hmm.
I say that because people say $1,900 a month for the year, that's a lot of money, right?
Yeah.
Then don't get me wrong, 2,100 is a lot of money too, but it's not all year, you know. But I don't even want people paying that. So we look at the foundations. There's no foundations open. So I will go through, I will call a patient, I will screen them, I will from an eligibility for income. There are little tips and tricks that if your adjusted gross income on your taxes is lower, these programs will use that number.
Oh, wow.
Okay. Now it's not always lower, but I ask it because it's individual cases, depending on what's going on with someone financially, and they're retired and did they draw money out of a, retirement fund or whatnot. So I will coordinate that. I will get all the paperwork signed by the provider. I don't want patients to do anything. And, I can send it to them electronically to sign so that they don't have to come in. We do all different kinds of things, and I will manage that process until completion. So in this case, typically what would happen is we get an approval, and then they get approved for the program, typically for up to a year or that calendar year. It kind of depends. Some of the programs are changing things around a little bit. But in this particular case, this manufacturer, if someone got approved today, they would be good till the end of the year, and then we reapply.
Oh, wow.
And I monitor that. And I monitor so that re-enrollments are done timely. So there's no gap in coverage. And medication is shipped to the patient's home from a specialty medicine. And behind the scenes, I always tell people in the background, I am hovering to make sure they're getting their medicine every month so that there's no issues with it. And I always have patients put my number in their phone so that when I call them, they know it's me. Some people put my name, they put Karen, and then they put dollar signs.
Yes.
I think
money and
I
funding.
think I'm in many people's phones with that,
Yes.
just so they know. But, I always tell them, if you have a problem or issues or whatever, I am a good single point of contact. Sometimes having to call the provider's office,
Right.
You're going through the switchboard
and running into
right,
barriers. Right.
I can get a direct line. I could find Michelle hiding in the corner, taking a nap during the day, but I can get to a provider or get to a nurse or whatnot. And when it comes to the medicine, I can call the manufacturer because I'm going to know what to say.
Yeah.
They might just say, oh, I didn't get my medicine. And they say, oh, well, we sent it,
Right.
I don't want them to have to deal with it. So I usually just deal with it. But this is sort of a very typical, this is a typical drug that's prescribed a lot. And this is the typical process that I go through to get folks medication. So that's kind of an ongoing. I touched on this one already earlier, where somebody needed a name brand and then it went generic. And I just had to do this recently. The copay with the generic card was not as good. He couldn't afford it, and his insurance had changed what it would cover. And that's something else I'm going to always encourage people to do. Every year, look at your insurance, because somewhere things are changing a lot. And even though I have patients all the time will say, oh, well, I'm dealing with Humana, and they've been good to me so far. And I say, I would still look at it every year.
Actually, absolutely.
Because our landscape here in healthcare is changing. These insurance companies are changing. Premiums are high. They're looking at ways, unfortunately, not to cover all the time. And that, if you're a Medicare recipient, go see a broker. Yes, they're selling too, but they're still going to be able to present you 3 different plans or 4 different plans. Whereas you get on the phone and you call United Health, they're just going to tell you their plan's the best.
Yeah.
And they're going to say, these are our 3 plans, where you really want to go to somebody who's going to say, these are all the drugs I take. This is all, my medical background. What are the best plans in the South Carolina area?
Yeah.
Right?
And for the viewers who don't know, Karen, please tell us, when is open enrollment?
Open enrollment for Medicare typically starts in October and it goes to early December. That is the window of opportunity if you are going to make changes, to make changes. And I really, really encourage people to do it just for your own due diligence. Because like this young man that I talked to, it was his plan. He said, I didn't really look and I didn't know. And I just took the same plan I had last year.
With the assumption
Now,
that things would be
he
the
would have
same.
never known a drug was going to go generic
Right.
and that, that card wasn't going to be as good, but I mean, fortunately it worked out and he's back on the brand for nothing. So he doesn't even have a copay card or a copay. So those are some things. This has happened with this specific drug 3 times, probably in the last 4 months for me.
Wow.
For patients who have been taking this drug. So
this is really good information because some of the things that you would think is self-explanatory or a given, because sometimes, even as me through my own health experiences, far as assuming, well, I have insurance, sure enough, it would cover. And that's not always the case.
No.
And so I'm glad that you're touching on, good points and fruitful points, far as if you should get a, bill, checking and making sure this is accurate, far as, the date of service, what the service and entailed, and then 2, if you should receive a denial, not automatically, and of course, not wanting things to escalate to credit bureau, but more so too using what resources, like you said, far as an appeal and not knowing what the outcome would be, and you can at least say you exhausted that option versus, like you said, paying tons and tons of dollars out of pocket when all along there was a resource that could have been to your benefit. So
right. And I mean, most hospital systems will do payment plans for people. I just prefer to, find any resources we have available or that we know of. I don't want people, I have heard horror stories of people tapping into 401ks and pulling money out. And I know there is a income threshold that people just won't qualify for programs.
right.
There is a demographic of people that happens to. But I don't run into it a lot here. It doesn't mean it's not there, because I have talked to people that have had that happen. But some of them were in a hospital system that did not have navigation and nobody helped them.
And
nobody
it speaks
and
to the
nobody
point that you
nobody said
do.
anything to them. This is how it is.
Yeah.
So I just encourage people to ask questions. Like we said earlier, do you have somebody who helps with this? Do you financial counselor, financial case manager, social work? I mean, whoever, I just encourage people to do that. And this case study is we kind of touched on this already, but it's where someone received a denial for, their infusion drug. And what do we do? And really it goes back to, and again, it's horrible that people have to do this. And this typically would never happen here, because somebody would have never gotten this far without having met with a financial counselor. Right? So we would have gotten ahead of this.
Mm-hmm.
But not all hospital systems do,
Right.
right? They just don't. And so having to go through that process, um, I know it's stressful, but you really have to question everything and go back through the billing, through the codes, through the denials, through the appeals. There's times that something gets denied, you appeal it, that gets denied, and you can appeal the appeal denial. How about that? Like, right?
And taking those steps with guidance, and I think even like speaking to the point of different healthcare sites having different resources available and different people owning different responsibilities. And so, like you said, for those patients who don't have, a board full of different, a financial navigator, a social worker, I mean, even from someone being a peer specialist, as far as just knowing how to navigate, or a patient advocate as such, I think it's so good that you're touching on, for those who don't have access to these type of services, these are the things that you can take even as a patient.
Yeah,
you know?
yeah. Because where do you start,
Yeah.
right? Like if I didn't do this, I mean, there's a lot of educated people
Mm-hmm.
and it's still complicated,
Absolutely.
right? So where do you start and what terminology and, you get people on the phone and insurance and they say, okay, the appeal got denied, and then you think you're done. But you know what? You can deny the appeal denial. Do you know what I mean?
Yeah. Yeah.
So, it's, I always tell people, I feel fortunate to work for an organization that does have this role.
Amen.
And I have worked for other hospital systems that had similar roles, right? So I worked at another hospital system where I didn't really do the medication piece, but somebody else did.
Mm-hmm.
So, but at least it was still there, and we
Yes.
collaborated and worked together and surrounded people with resources of people that could help. It's I I have a hard time understanding how a hospital system wouldn't have this, especially in a um, for a cancer center. But they
It
don't.
happens.
It happens.
It
It might not be
does.
here, and I'm not familiar with all the hospital systems, because if everybody can't tell, I don't have Southern accent. Don't hate, don't don't hate the game. Don't hate the player. Hate the game. I came from the north.
No,
But
but it's true. It's true.
it's hard for me to wrap my head
Yeah.
around it, but it is. And so, you know, I, true story. I was on TikTok and something came up about financial toxicity, and I read through the comments, and there were people in there that truthfully, I wanted to cry, who had gone through their cancer journey with no help. None.
And as you can imagine, of course, that's why I'm always so appreciative when patients have a spouse, friends, family, church community, colleagues. I mean, because the example that you're even, walking into, far as addressing just being already alone and feeling isolated, and then having to navigate all of these different barriers. And it's sad. And I think it speaks to the passion that you have, as well as I have, to not only put both of our thinking caps on and bounce, different suggestions or, resources, and say, well, have you tried this? Have you linked with our social worker? Well, I'm not aware of that information, but let me get you to our financial navigator. And a lot of people don't know. And I will encourage you as well to seek out a social worker. That's part of our role, as far as resource linkage. We may not have, the knowledge as to, some of the things that she's even speaking to that she does on a daily basis, but knowing who to connect people to, and knowing what roles, does what. And I think that's sometimes because you could assume and say, well, I already met with a social worker, but it doesn't stop there,
No.
you know? And so,
Well, they already met with a social worker, but when they're talking to me, a topic comes up that didn't come up when they were
right,
talking to a social
previously,
worker.
yes.
Because, you know, my role is a hybrid role, right? This is the way I view it. I am very social work like.
Mm-hmm.
I am focused on the financial aspect, but people still talk to me
Absolutely.
and tell me things, and I engage with them because I want people to feel heard. I feel for what they're going through. And I'll be honest with you, there have been many times I have been inspired by people because I don't know how I would feel
Mm-hmm.
or what, you know. And
Absolutely.
I am inspired by people who have such optimism
Mm-hmm.
and such strong faith, right? I'm always reminded of my faith when I talk to some patients who, um, so, people say to me, "Oh, Karen, you've earned your wings. You're going straight to heaven for doing what you're doing." And I always tell them, I'm working out of a deficit. I'm not quite even.
Yeah.
I'm working out of all the
I'm
things I
still
did
doing,
wrong.
yes,
I'm giving up.
yes.
But you know, people, um, people teach me things too, and remind me of things. So as I'm helping them, I am reminded if I'm having a woe is me day, and then I
Mm-hmm.
talk to a patient who, just got diagnosed and is going through this process, it's kind of a, reminder to me to like, boo hoo, boo hoo.
So, Karen, as we wrap up for this evening and with just overviewing, the different case studies as well as some of the touching points far as a direct patient, what things to consider and what resources may be available, of course, depending on, your particular healthcare or oncology site, as well as state what things, far as from an insurance standpoint, having different benefits. If there was one thing that you could leave with a patient who's, encountering a new diagnosis or even a loved one that's pretty much stepping forward and kind of trying to be, a form of support where the patient might not feel like they can meet their own needs, what is one thing that you would stress or even just encourage them as a financial navigator?
The first thing I definitely encourage is talk to your provider. Make sure you're asking, is there help, right?
Mm-hmm.
So that they can connect you with the right people, should they have that within the organization. Know that almost every high cost drug has a program. So don't assume that you're out of pocket copay. There isn't a copay card. Most of the high cost drugs have manufacturer programs.
That's good.
And then, whether it's community resources, there are some,
Mm-hmm.
that will help with cost of drugs and
Yes.
stuff. What is it here?
So far as for Greenville County, they have the neighborhood cancer
Right, right.
connections.
So they
So
will pay for
yes, local organization.
medications.
Yes.
So ask, and foundations. Even if you went into Google and said, can, what resources are available to help me with my oncology drug? Those foundations will come up.
Mm.
So Health Well Foundation, Patient Advocate Foundation, Cancer Care, Blood, they changed the name.
Leukemia and Lymphoma Society.
Yeah, they
But
changed
yes,
blood.
blood cancers, I think is
Yeah,
something.
blood
Yes.
cancer. So, those resources, are out there.
Absolutely.
So ask questions. Don't feel like, don't feel dumb because you're asking questions.
Mm-hmm.
And because it's a complicated system, and for the most part, I think there are organizations that can help,
Well said.
you
Well
know,
said.
but don't be afraid to ask for help.
Yes, I agree. And again, we want to thank everyone for joining us this evening for tonight's topic. Again, my name is Michelle Allen. This is Karen Hausner, and we appreciate you supporting the Cancer Survivors Park Alliance. And we look forward to you joining more topics in the near future with our prevention and wellness program. Take care.
Thank you. Thanks, Michelle.